Hello, friends. Welcome to the third lecture in the series of Let's Simplify Orthodontics for dental students. In this lecture, we will be talking in brief about the history of orthodontics and how it has evolved from the ancient era to the modern era. Orthodontics, as we know, is the oldest specialty in dentistry and dates back to the turn of the 20th century. Orthodontics, the term, comes from two Greek words, orthos meaning right or correct, and dontos, meaning tooth. Orthodontics is blessed with a rich history, with the earliest evidence of tooth movements dating back to the 10th to the 1000 BC in the Greek and Etruscan excavations. Reference of movement of teeth and the jaws are also found in the writings of Hippocrates 460 to 377 BC, Aristotle 384 to 322 BC, Aureus Cornelius Celsus, 25 BC to 50 AD, who advocated the use of finger pressure to allay irregular teeth. Father of modern dentistry, Pierre Fauchard, 1678 to 1761, is credited with the first recognized orthodontic appliance to move teeth, popularly called as the bandalet or bando. John Hunter was the first to explain normal occlusion and to attempt classification of teeth and to describe growth of the jaws. His articles also mention the removal of certain teeth to correct certain teeth irregularities and proclination. Joachim Le Fallon is credited with coining the term orthodontics. Norman Kingsley introduced many innovations in orthodontics, which include use of occipital traction. He performed the first teeth extraction and moved the anterior teeth behind into the extracted space. Later on, he discontinued extraction and added an inclined vulcanite plane and coined the term jumping of the bite. Emerson Angel was the first to open or advocate the opening of the mid-palatine suture with the help of a split plate, a procedure which became popular as rapid maxillary expansion. However, the father of modern orthodontics is Dr. Edward Hartley Ainol. His contributions include he introduced the first recognized classification of malocclusion. He started the School of Orthodontics in New London, Connecticut. He introduced certain appliances like E-arch, pin and tube appliance, ribbon arch appliance, and the edgewise appliance. He advocated non-extraction philosophy or non-extraction treatment for all patients. Because of his efforts, orthodontics came to be known as the specialty of dental science. Henry Baker introduced the use of intermaxillary elastics for correction of proclination of anterior teeth. Came to be popularly known as Baker's anchorage. Calvin Case was Engel's contemporary and his harshest critic, advocated extraction of certain teeth so as to correct facial deformities. In contrast to Engel's dependence of occlusion, he emphasized facial aesthetics and also used different types of appliances. He advised changing of the specialty's name from orthodontics to facial orthopedics or facial orthopedia. Holly Broadbent and James Wofford revolutionized the diagnosis of malocclusion by introducing cephalometric radiography as a diagnostic tool in orthodontics. Melvin Moss introduced functional matrix hypothesis or functional metrics theory, which received international recognition as the most widely accepted theory for growth and development. He also introduced finite element analysis for the modeling of craniofacial growth and the orthodontic treatment effects. Michael Bunoco in 1955 introduced acid etching technique, which was a groundbreaking invention, not just in orthodontics but also in dentistry as well. Dr. Percival Raymond Beggs of Adelaide, Australia, introduced the Beck appliance in the 1950s, which is used light round wires for tooth movement. This was extremely popular throughout the 50s and the 60s and the 70s, and in India till the 1990s. In 1972, Dr. Lawrence Andrews published the first paper on the 6 keys of normal occlusion, which became a benchmark or a yardstick for successful orthodontic treatment. He refined the edgewise appliance of Dr. Edward Angle and introduced the pre-adjusted edgewise appliance, but popularly known as the straight wire appliance, which would apply the first order, second order, and third order movements into the teeth or into the brackets without making changes in the arch wire. Dr. Ronald Rocks introduced the concept of functional occlusion and modified the Andrews edgewise appliance. The demand for a more aesthetic looking orthodontic appliance led to the invention of ceramic brackets. Lingual orthodontics was introduced by Dr. Kinya Fujita of Japan and Dr. Craven Kurz of the United States of America in the 1970s. Clear aligners in orthodontics were introduced by Giachisti and Kelsey, who developed the Invisalign system of aligners. Presently, aligners have become increasingly popular, although it is important to understand that not all cases can be treated by clear aligners. Common questions asked in history of orthodontics are mostly in multiple choice questions and short answer questions. Edward Angle's contributions to orthodontics is a common question asked in section 2 of the university exams. Are asked in vivas. For example, who invented acid etching, or who invented the first recognized orthodontic appliance, or who was the father of modern orthodontics, or who was the father of dentistry. So students are expected to know all these names by heart and the year in which these inventions were taken place. If you like our lectures, do like, share and subscribe to our YouTube channel. For any doubts or queries, kindly mail us on our official email ID, let's simplify orthodontics@gmail.com. Your feedback is valuable. Thanks for watching.